Hello, my name is Dr. Sean Raj, Chief Innovation Officer at Simon Med Imaging, and today I'm really excited to share with you a little bit more about our new exam, DEXA with TBS. We believe this test is going to revolutionize the way we all think about bone health, and Simon Med is very excited to be leading the effort. As you all know, bone density increases in the first few decades of life and then declines, especially affecting women because of menopause. In fact, 1 in 2 women and 1 in 4 men will experience an osteoporotic fracture in their lifetime. And there are many, many reasons for increased osteoporosis and fracture. Our current exam, DEXA, is outdated. There are many good things about DEXA. There's numerous studies. It tells you about bone quantity, but the thing is, it doesn't tell you about the quality of that bone. Let me show you what I mean. So here are two patients. They have the same bone mineral density, but you can look at it and say, well, I'd rather have the top picture than the bottom picture as my bone, right? It's because of the quality of bone, the architecture of the bone. And that is the story of TBS. Bone mineral density does a good job, again, of telling you how much bone there is, but it does not tell you about the bone architecture. And so how does this impact you and your practice and your patients? Well, it can help you across the board, but let me just focus on one case that you guys probably often face, which is osteopenic patients, right? Osteopenia is intermediate range, but what we know with TBS is you can have an osteopenic patient with really, really poor microarchitecture. And in these patients, we are identifying 30% of patients more at risk of developing an osteoporotic fracture that have been labeled as osteopenia. So now TBS will allow you to act on this subgroup of patients. DEXA plus TBS is FDA-approved AI software. And again, it reveals structural weaknesses that BMD alone cannot see. There is no extra radiation. There is no extra scan time. And we will allow you to now provide tailored treatment plans for every subcategory of patient. And this is a sample TBS report. You will still have all of your expected DEXA results, your Z-score, your T-score, your FRAX, but now we'll also give you a TBS-adjusted BMD and a TBS-adjusted FRAX, which again is going to be much more precise. We know that Medicare generally covers DEXA every other year for women above the age of 65 and men over the age of 70. Other organizations recommend starting even earlier, some even as early as 50. About 20% of women over age 50 have osteoporosis, right? So this is an individualized conversation. But the point is, TBS is now unlocking a whole nother, more precise level of insights that we can share with your patients so that you can make the best treatment decisions for your patients. All DEXA orders at Simon Med will now include TBS when available, if available, which again is at the vast, vast majority of all our centers. The way you order this is screening DEXA with TBS, CPT codes 77080 and 77089. You can see the self-pay rates are all very reasonable. And finally, if you have any questions on DEXA plus TBS, please feel free to reach out to your Simon Med representative, and I'm personally happy to answer any questions as well through your representative. Thank you so much for taking the time. Really excited to share this new paradigm in bone health.